Mounting evidence supports water, sanitation, and hygiene as critical components to improving the quality of care in healthcare facilities. With the recent spotlight on healthcare-associated infections and recurring outbreak threats such as Ebola and cholera, the need to improve WASH in healthcare facilities has emerged. The slides that follow describe several challenges in the WASH for healthcare facilities space before outlining 7 recommendations for ministries of health, international donors, and implementing organizations to consider. Our central question is, why hasn't the WASH sector better integrated their efforts with healthcare systems and health governance, particularly to improve maternal and perinatal health? To answer this question, we must recognize 5 common challenges in healthcare systems. The first challenge is evidence. Though WASH for child health has received great attention, the data linking WASH with maternal and perinatal health outcomes has been limited. The measurement of health service quality and performance outcomes as a function of WASH is almost completely absent. Ensuring technical solutions that are comprehensive, practical, and cost-effective is also a challenge. Efforts towards incorporating WASH concerns into healthcare facilities often involve uncoordinated technical interests with 2 primary professional sets at play: engineers or technicians and health professionals. To generalize, engineers build infrastructure while biomedical health professionals treat diseases. Neither group has adequate training in the other's specialty. Additionally, the more behavioral and managerial aspects of WASH in healthcare facilities are often neglected. A third challenge concerns institutional governance issues. WASH in healthcare facilities rarely has an institutional home. Instead, the governance gets bundled under water and sanitation or water resources, which in turn may be divided among multiple ministries, government bodies, and interests. For example, ministries of urban planning, public works, water, rural development, lands, mines, energy, forestry, environment, and health could all have some managerial responsibility for WASH. Even if water, sanitation, and hygiene is included in the Ministry of Health's planning, WASH in healthcare facilities is often a low or decentralized priority. A fourth challenge relates to global policy and accountability. While the World Health Organization, UNICEF, donors, and other development agencies work with governments to develop standards and protocols in WASH, no entity has assumed the bottom line accountability and mandate for WASH in healthcare facilities. Lastly, we cannot ignore the effects of persistent financial challenges. Like many sectors that cross disciplines and institutional entities, WASH in healthcare facility financing is vertical and spread across ministries and interests. There's often a lack of clarity over who's responsible for improvements and who should pay for them. Despite the political, technical, institutional, and financial barriers, ministries of health are at the forefront of maternal and perinatal outcomes, and therefore need to assume accountability for improving WASH in their facilities. The following 7 recommendations aim to achieve this outcome. First, empower ministries of health with the WASH in healthcare facilities mandate. Ministries of health should ensure that each facility plans for and budgets for WASH improvements. Some improvements, like infrastructure, may require Ministry of Health to engage other actors, like the Ministry of Water, while improvements like hygiene or management improvements can be integrated into existing systems. Second, focus on management. Health management should access and oversee funding for WASH projects at the facility level while ensuring staff are both validated and held accountable for improved WASH behaviors and activities. Third, invest in health worker capacity. University teaching hospitals require more robust WASH curricula that provide health staff the tools to understand and problem solve around WASH. In-service trainings ensures health staff are up to date on the latest infection prevention and WASH in healthcare facilities data and information. Fourth, accountability to the community. While experience shows many community-managed schemes are unsustainable, communities served by health facilities can have a representative role in managing health facilities to strengthen accountability. When the community has a voice, they have ownership and pride, which in turn motivates health facility staff to provide better services. Fifth, integrate with other cross-sectoral health platforms. Quality improvement and healthcare systems strengthening offer two platforms with which WASH and healthcare facilities improvements can integrate. In their 2014 publication titled From Joint Thinking to Joint Action, a call to action on improving water, sanitation, and hygiene for maternal and newborn health, Dr. Yael Velman and colleagues recommend that efforts to reduce maternal and newborn mortality and morbidity should adequately reflect WASH as a prerequisite for ensuring the quality, effectiveness, and use of care services. A sixth recommendation is to include WASH indicators in regular monitoring and develop coaching supervision approaches. Providing regular supervision serves to motivate health care workers while also holding them accountable. Coaching helps less skilled health workers gain confidence and interest in WASH. Lastly, improve measurement. To start, we recommend that ministries of health invest in collecting national data on links between WASH and maternal and perinatal health and the effectiveness of WASH programs on maternal and perinatal outcomes. Ministries of health and their partners should strive to collect data on the Joint Monitoring Program's new WASH and healthcare facilities indicators in order to contribute to global monitoring systems and to galvanize global support for WASH and healthcare facility improvements. Increasing evidence has illuminated an accountability gap for improved WASH and healthcare facilities. Ministry of Health ownership and additional investments, particularly in healthcare facility management, can result in improved health outcomes, higher perceived quality of care, and better results, especially for mothers, babies, and children.